Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with dry wax and dead skin, so keratin in both ears. You can probably tell here that they had been using a Q-tip, or as it's known in the UK, a cotton bud, because there's an indentation. There's an imprint of the circular tip of the Q-tip and cotton bud in the wax, and it just lodged it further in. So the way I'm tackling this, I'm using a microsuction probe. This is called a Zollner suction probe. And I'm just slowly elevating the adhered skin off the canal wall. I've just applied some olive oil spray into the ear just to lubricate the ear canal wall. And that's because this skin is strongly adhered. So I just want to help to loosen it. And also the skin was somewhat blocking the suction probe. And the oil not only helps to loosen the skin off the ear canal, but it also is designed to lubricate the inside of the suction probe, so any debris, wax, skin that travels through it doesn't get blocked. So we can see we've managed to manipulate and remove the more lateral dead skin and wax near the entrance. And this is the more medial section. This is more deeper in the ear. And you can also see that the core, there's quite a few hairs. And so this skin and wax has become matted. Now these hairs typically should be on the outer third of the ear canal, and again, the fact that it's embedded within the wax and skin plug, it suggests anyway that the patient has been using a Q-tip. Sometimes, however, and I'll come back to that in a moment, you can see the patient's eardrum, it's nice and healthy. So the ear canal is quite broad at the entrance. If I'm going to go in here, I'm going to angle the endoscope to the left. It's quite a large diameter there. The average diameter, or the width, should I say, of the ear canal in this portion, so near the entrance, is possibly around 5 to 7 millimeters. I would say this is probably more 8 to 10 without measuring it, but it's got a quite wide. It's more, normally the ear canal height is greater than the width, but at the entrance of the ear anyway, this patient's ear canal is the height is actually shorter than the width, so the width is greater, which creates, so if you think about the ear canal being an oval, like an American football, that's probably a good analogy for one to compare. But that's at an angle that's rotated by 90 degrees, so it's on a horizontal plane. That's what this patient's entrance of the ear canal is like. So that's the right ear complete. So we're just now on the left side, and again, it's got some dry skin. Now, the entrance in this ear is collapsed. The cartilage had weakened near the entrance. That normally can happen in elderly patients. Similarly to the cartilage, the tip of our nose, over time, gravity takes its toll, and the cartilage can weaken and droop. We can get a droopy nose. And in the same way, the cartilage in the ear, the outer part of the ear canal is made of cartilage, the inner 2/3 of bone, so the cartilage can weaken and it can collapse near the entrance. That makes it a bit more difficult to perform the procedure because the endoscope itself, the diameter of that is 2.7 millimeters. The suction probe that I'm using, the Zollner suction probe, is around 2.2. So already we're at 4.9 millimeters. And as I said, the average ear canal at this portion is around 5 to 7 mil wide. And the entrance it's almost completely collapsed. It's far, without stretching the ear, the instruments wouldn't be able to insert it in the ear. So we're using the endoscope to stretch the cartilage to the right, the entrance of the ear canal. And we're then using the endoscope as a doorstop. So we're stretching the ear with the endoscope and then positioning the endoscope, lodging it almost like a doorstop to keep the entrance ajar, which then allows me to insert the instrument of choice. Just going back to a point I was making in the right ear about those hairs. So those hairs in the ear are normally located on the outer third, the cartilaginous portion. That's where all the hair follicles are found. There shouldn't be any hair follicles stemming from the bony part of the ear canal because it's literally just skin on bone there. There's no way the hair follicles can be found on the bony part. So it could be that the reason why it's matted, it's been pushed in, the cotton bud, but sometimes when patients trim the hairs, they're tragal hairs. So just at the entrance of the ear, you'll see everyone's had it. We've got this almost a triangular piece of cartilage, and that's called a tragus. Sometimes you can get piercings there. People get piercings there, and you can actually wriggle that with your finger. And there's hairs that grow on there and around that region, and a lot of patients can trim their hairs. And what can happen is when you trim your hairs, or even when you go to the barber and they trim your hair and some hairs fall loose into the bowl of the ear, these hairs can eventually find their way into the ear canal and mat. So a good piece of advice or tip is, if you are trimming your hairs, just get some cotton wool. Just you can put a bit of Vaseline around it if you want, but just tap it just at the entrance. So just position it near the entrance. You don't want to push it in, just in case you have got wax, and obviously you're going to have to remove the cotton bud afterwards. Just position it at the entrance, create a seal, trim your hairs, and then you can remove the cotton wool, so it just closes the door, closes the entrance of the ear, so no hairs can go in. So making good progress here now. Because I said this ear is a bit more narrow, it's a bit more twisty as well. The skin adhesions are a lot stronger. I've just about managed to get the forceps in. It is difficult because the ear is narrow. And again, just using the forceps, trying to stretch the ear open. And I'm trying to get it both sides of this dead skin. It's really gentle and delicate. There were a few hairs remaining in the ear. I just left them. It has been hard to remove them. They didn't come out with suction. And they're a bit deep. And as I said, because the ear is narrow, it's hard to get the forceps in. It's not going to affect the patient. I've got a few hairs in my ear. I think if you follow me on my Facebook account at the Hair Clinic or Instagram at the Wax Whisperer, probably going back to the beginning of January, I had a bit of an ear infection. I had glue in. I took images of my ears and I put it up on Facebook and Instagram, and you'll see my ears. I've got quite a few hairs that are just stuck around the medial part of the ear canal on the eardrum. It doesn't affect me at all. I think one or two patients in the past that I've had, they've had excessive hairs and they found it tickled a little bit. Mine don't tickle at all, and we try and remove those if possible. But on this case, I just decided to leave it because it's challenging enough just to get in the ear. So just you can see the eardrum in the distance. The hearing's much, much better. In fact, the hearing is as good as it's going to be, even if I end up removing all of this, which I kind of more or less do. It's not going to help them hear any better, but whilst the patient's here, I just want to, whatever I can get out safely, I will. So I'm just using the fine end suction probe here, and this skin, it's really adhered, and it's all the way to the eardrum, and I'm just going to take it off the side walls first, on both on the right and on the left. And because it's a narrow twisty ear, don't have too much room for manipulation, so I'm making these little circular movements. Normally they'll be more exaggerated, but they're really, really small, and I'm just trying to tear that skin. You can see I've just teared it away from deep in the ear. So that's the eardrum and the distance and a few hairs, and as I said, we just decided to leave those. Just at the entrance, we've got some really dry, sticky coating. This is dead skin. It's very sticky there at the entrance. So I'm just gently just hovering the fine end over it. Because we're on the cartilaginous portion, we can apply a bit of pressure. So I hope you enjoyed that video, guys. Take care, keep well, and remember, be nice, be kind. Cheerio, bye.